What if I told you that your hair loss may have started years before you noticed a single hair in your brush? What if the hair itself isn't actually the problem? Every week, I see patients who have spent hundreds, sometimes thousands of pounds in a short space of time on shampoos, serums, supplements, oils, and treatments. They've changed their shampoo 6 times in the last 3 months. They've bought the viral product. They've tried the rosemary oil, and yet their hair continues to thin. Why? Because hair is often the messenger, not the problem. And before you close this video thinking, great, another person telling me it is stress, that's not where we're going here. Stress can indeed influence hair loss, yes, but it is rarely the whole story. What I want to show you today is something most people never hear. Your hair follicle is constantly listening to your hormones, your immune system, your nutrition, your thyroid, your metabolism. And when those systems begin to shift, your hair often notices long before you do. My name is Desiree. I'm an advanced hair, scalp, and skin practitioner with almost 30 combined years of experience in this industry. Throughout my career, I've worked with patients experiencing hair shedding, thinning, pattern hair loss, scalp disorders, hormonal changes, autoimmune conditions, and nutritional deficiencies. And one thing has become clear across all of it. Most people have been taught to think about hair completely backwards. We've been taught that when hair changes, we should look at the hair. But the more useful question is almost always, what changed inside the body before the hair changed? Because the hair follicle is not separate from the body. It is part of the body. It responds to everything happening inside it. Let me tell you about a patient. She came into clinic convinced she had developed an allergy to her shampoo. She said her hair used to be thick. Her scalp felt different. Her hairbrush was full. And on the surface, that sounds like a reasonable conclusion because humans naturally connect the thing they can see to the problem they are experiencing. But when we sat down and talked, something else emerged. Over the previous year, she had also experienced poor sleep, increased fatigue, changes in her menstrual cycle, adult acne, weight gain, and increased facial hair growth. She had never connected any of those things to her hair. They felt like separate, unrelated complaints until we mapped them together on a timeline. The moment she saw that timeline, her expression changed because suddenly it wasn't a hair problem. It was a pattern, 6 symptoms, all appearing within the same 12-month window and pointing in the same direction. The story wasn't about shampoo. The story was about hormones. And that shift from treating the visible symptoms to investigating the underlying signal is exactly what this video is about. Here's the lie the hair loss industry keeps repeating, that hair loss is one condition with one solution. It isn't. Hair loss is a symptom, and symptoms have causes. Think about someone walking into a room coughing. You wouldn't automatically assume they have one specific illness. They could have a cold, asthma, pneumonia, an allergy, a viral infection. The symptom looks the same. The cause is different. Treatment for one won't for another. Hair loss works exactly the same way. And this is where people lose years chasing solutions to a symptom without ever identifying the cause. Think of your hair follicle like an airport control tower. Every second, it's receiving information, nutrition levels, stress hormones, immune activity, blood supply, energy availability, and it is constantly running a calculation against all of that incoming data. Is this a safe environment to grow? Do I have the resources to continue? When the answers are favorable, growth continues. When enough of those answers become uncertain, the follicle adapts. Not because it's malfunctioning, because it's responding exactly as biology designed it to do so. This is why I tell patients, hair loss is frequently a response, not a failure. The follicle is doing its job. We just need to understand what it's responding to. This next part surprises people. Your body does not consider hair essential. If your body has limited resources, what does it prioritize? Your brain or your fringe? Your heart or your ponytail? Your lungs or your hairline? The body prioritizes survival first. appearance second. And this is why hair often changes during illness, prolonged stress, hormonal shifts, nutritional deficiencies, pregnancy, and autoimmune diseases. The follicle is responding to what the body perceives as the most urgent priority. Hair production is expensive. When resources are under pressure, it's one of the first things the body reduces investments in. Hormones are chemical messengers. Think of them as signals sent around the body, not to one person, but to entire organs and tissues simultaneously. A hormone might instruct a cell to grow, store energy, produce oil, build tissue, prepare for pregnancy, increase metabolism, or slow it down. Because hair follicles contain hormone receptors, they receive those messages too, which means anything disrupting the hormonal messaging system has the potential to show up in your hair. Imagine your body is a city and hormones are the communication network. Without that network, traffic collapses, power stations stop functioning, emergency services can't coordinate. The same principle applies biologically. Hormones coordinate growth, repair, energy production, reproduction, stress hormones, sleep, immune activity, hair growth, and scalp function. Everything. Most people think hormones work independently. They don't. They operate in a hierarchy. At the top sits a small region of the brain called the hypothalamus, acting as the chief executive. The hypothalamus communicates with the pituitary gland. The pituitary gland communicates with endocrine glands throughout the body. Those glands produce hormones. Those hormones affect tissues, and those tissues send information back. This creates what we call feedback loops. Think of the thermostat in your house. When temperature rises too high, the heating switches off. When it drops too low, it switches on again. Your hormone system works on exactly the same principle. The body monitors itself continuously and adjusts. When this communication network is functioning well, balance is maintained. When it becomes disrupted, symptoms start appearing, and sometimes hair is one of the first places we see it. Many patients come in complaining about hair loss, but when we dig deeper, they also mention that their skin has changed, their scalp has changed, their nails have changed, their energy has changed. That's not a coincidence. Those systems are connected. Hormones don't just influence hair, they influence collagen production, sebum output, skin hydration, skin thickness, barrier function, inflammation, wound healing, and scalp oil production. When hormones shift, the hair, skin, and scalp often change together. I call this the hair, skin, and hormone axis. Which brings me to a patient who came in for skin, not hair. She wasn't concerned about hair loss. She came in because her skin felt different, drier, thinner. She said she no longer recognizes herself in photographs. During the consultation, she mentioned, almost as a side note, increased shedding, a widening parting, poor sleep, night sweats, changes in her menstrual pattern. She'd categorized those as separate problems. Skin was a skin issue. Hair was a hair issue. Sleep was just life. That's what she thought. But taken together, they formed a coherent picture. The skin was a signal, the hair was a signal, the scalp was a signal, and all three were pointing at the same underlying shift. This is why I always say, never look at the symptom in isolation. Look at the patient. Every follicle is continuously running 4 checks. Do I have enough nutrients? Do I have enough oxygen? Is the hormonal environment stable? Is the immune environment safe? When the answers remain favorable, growth continues. When enough of those answers become uncertain, the follicle adapts. And this is where most people get caught out. They focus on symptoms rather than the question the follicle is trying to answer. Most patients ask, what products grow hair? The better question is, what is stopping my hair from growing normally? Once you understand that difference, everything changes. You stop chasing products and you start investigating causes. So now that we understand what hormones are and how the follicle is always listening, we need to talk about which hormones influence hair the most. And I'll tell you now, one of the most blamed hormones in hair loss isn't actually the villain people think it is. And one that most women never consider may be influencing their hair every single day. Now that we understand what hormones are and how the follicle is constantly reading signals from the body, we need to get specific, because one of the biggest mistakes I see is patients becoming fixated on a single hormone while ignoring the rest of the system. Hair follicles don't respond to one hormone. They respond to an entire hormonal orchestra. And when one instrument starts playing out of tune, the follicle notices. Testosterone, the most misunderstood hormone in hair loss. Whenever testosterone comes up in a hair loss conversation, people immediately picture muscles, men, aggression. But testosterone does far more than that. It influences muscle mass, bone strength, libido, mood, energy, red blood cell production, and yes, hair growth. And here's something that surprises many of my patients. Women produce testosterone in much smaller amounts, of course, but they produce it. If testosterone supports hair growth, why does everyone blame it for hair loss? You wonder. Because testosterone itself usually isn't the problem. What happens to it next is some testosterone is converted into another hormone called dihydrotestosterone. This conversion happens through an enzyme called 5-alpha reductase. Think of testosterone as regular coffee and dihydrotestosterone as the espresso. Same origin, more concentrated, more potent, more biologically active in certain tissues. And here's where it gets interesting. Hair follicles are not all identical. Some barely react to dihydrotestosterone. Others are highly sensitive to it. Imagine two brothers, same parents, similar diets, similar lifestyle, similar testosterone levels. One reaches 50 with full head of hair. The other starts thinning at 25. The hormone levels aren't necessarily different. The follicular sensitivity is. This is a distinction most hair loss content never makes. It isn't always about how much of a hormone you have. Sometimes it's entirely about how your follicles interpret the signal. When sensitive follicles are repeatedly exposed to dihydrotestosterone, a process called follicular miniaturization begins. The follicle gradually shrinks. Each successive growth cycle produces shorter hairs, finer hairs, less pigmented hairs. Patients rarely describe it in those terms. They say things like, my ponytail feels thinner, I can see more scalp, my hair doesn't grow the way it used to. That is often miniaturization in motion. A male patient came in convinced stress had caused his hair loss. Stress was certainly present, but under trichoscopy, we could see something else, miniaturization. His crown contained hairs of multiple diameters, some thick, some fine, some barely visible. That variation is the hallmark of androgenetic alopecia. Here's the important part. His stress wasn't causing the pattern hair loss, but it may have been accelerating shedding on top of it. Two separate biological processes, one visible outcome. This is exactly why diagnosis matters. Treating them as one problem would have failed him on both counts. Now we come on to estrogen, the hidden hair protector. Estrogen doesn't get the credit it deserves in hair loss conversations. Most people think of it purely as a reproductive hormone, but it influences hair growth, skin hydration, collagen production, sebum regulation, bone health, mood, sleep, vascular health. Think of estrogen as a supportive presence within the hair growth cycle. One of the reasons many women report their best hair during pregnancy is elevated estrogen levels. We'll come back to that shortly. Estrogen declines, collagen production declines with it. Skin becomes thinner, less elastic, drier. Many women describe the moment it happens with almost identical language. I suddenly look different. I don't recognize my face. What they don't often realize is that at exactly the same time, hair density is frequently beginning to change too. The skin is giving clues, the hair is giving clues, the hormones are the common thread. I call this the collagen cliff because it rarely feels gradual to the person experiencing it. It feels like a sudden drop. Progesterone, the calming hormone. Progesterone is frequently overshadowed by estrogen, but it plays important roles: menstrual cycle regulation, pregnancy support, sleep quality, nervous system regulation. Poor sleep is one of the most common complaints I hear from patients going through hormonal transitions. And poor sleep affects cortisol, recovery, immune function, and hair growth, which leads us directly onto the next hormone, cortisol, the survival hormone. Cortisol gets blamed for almost everything, and unfairly so. You need cortisol. Without it, you couldn't regulate blood pressure, manage blood sugar, respond to stress, or wake up properly. The problem isn't cortisol, the problem is chronic dysregulation. Think of cortisol as a fire alarm. If a fire starts, you want that alarm to sound, right? That's exactly what it is there for. The problem is when the alarm never switches off, when the body begins treating every challenge as an emergency: financial pressure, work stress, relationship problems, chronic illness, bereavement, sleep deprivation. The body keeps responding and the follicle keeps noticing. This creates what I call the shedding stress loop. Stress increases, shedding increases, the patient becomes anxious about the shedding, stress increases further, the follicle receives more stress signals, the signal continues. One important note here: stress should never be used as a lazy clinical explanation. Hair loss deserves proper investigation, always. But significant psychological stress can absolutely trigger telogen effluvium. And that's why thorough history matters. Insulin, the hormone nobody expects. Most people associate insulin only with diabetes, but insulin influences energy regulation, metabolism, inflammation, ovarian function, and androgen activity, which brings us to one of the most important and most misunderstood conditions in female hair loss: polycystic ovary syndrome. That is its previous name. Polycystic ovary syndrome is commonly described as reproductive condition. It is also a metabolic condition. Patients may have experienced irregular periods, acne, increased facial hair, oily skin, oily scalp, weight management challenges, and female pattern hair loss. And here's what most people miss: not every patient with PCOS has elevated testosterone. Many have levels within the standard reference range. The issue may instead involve increased androgen sensitivity, reduced sex hormone and binding globulin, increased free androgen activity, or insulin resistance. This is why a single blood result rarely tells the whole story. Patient came in with hair thinning, acne, and facial hair growth. She believed she was dealing with 3 separate issues and had been treating them separately for over a year. When we looked at everything together, the picture was immediate. Her skin was speaking, her hair was speaking, her hormones were speaking. All 3 symptoms were different expressions of the same underlying environment. Once she understood that connection, she stopped cycling through products for each individual symptom and started addressing what was actually driving all 3. That shift from symptom management to root cause investigation changed everything for her. This is exactly why I keep returning to the Hair-Skin-Hormone Axis. Symptoms rarely exist in isolation. The body is communicating all the time. The challenge is learning to interpret the message correctly. At this point, the pattern should be becoming clear to you. Hormones don't operate in isolated compartments. The body is a network, and hair follicles sit at the intersection of it, influenced by testosterone, dihydrotestosterone, estrogen, cortisol, insulin, often simultaneously. But we're still not finished, because there are specific stages in life where all of these hormonal influences converge and become dramatically more visible: puberty, pregnancy, postpartum recovery, perimenopause, menopause. Understanding those stages explains some of the most significant hair changes people ever experience. Up to this point, we've covered the hormones that influence hair: testosterone, dihydrotestosterone, estrogen, progesterone, cortisol, insulin. But most people don't experience hormonal changes as isolated biochemical events. They experience them as life. And every major hormonal transition leaves clues in the hair, in the scalp, the skin, sometimes years before anyone understands what's happening. So let's walk through the hormonal life story, because once you see it, especially when it's mapped out, you'll never look at your hair the same way again. Puberty is often the first major hormonal event that visibly changes hair, scalp, and skin. Before puberty, sex hormone levels are relatively low. The body begins producing significantly increased androgen and everything responds. One of the most common questions I hear from patients is, why is my child's hair suddenly greasy? The answer is androgen stimulating sebaceous glands to produce more sebum. It explains the oily scalp, the oily skin, the acne, the increased sweating that appear around the same time. More importantly, puberty teaches us something that becomes clinically significant later. Hormones don't just affect reproduction, they affect follicles. And what hormones can build, hormones can also change. Pregnancy is where many women experience what they genuinely believe is the best hair of their lives. Thicker, fuller, more voluminous. Most assume that the hair is growing faster. Actually, something more interesting is happening. Elevated estrogen during pregnancy extends the anagen phase, which is the active growth phase of the hair growth cycle. Normally, some follicles are always transitioning into rest. During pregnancy, far fewer make that transition. More hairs stay on the scalp simultaneously. The result feels like transformation, but it's retention, not regeneration. And that distinction is important, enormously important for what comes next. And that is postpartum shedding. Fewer things create more panic than postpartum hair shedding. One day, everything seems normal. Then suddenly, the shower drain is full. The brush is full. The floor is full. Patients ask me directly, am I going bald? Here's what actually is happening. All those hairs retained during pregnancy eventually have to complete their cycle. Once pregnancy hormones decline, large numbers of follicles synchronize and enter the resting phase together. Several months later, the shedding becomes unmistakable. This is postpartum telogen effluvium, and it is one of the most common forms of diffused hair shedding I see in clinic. But here's what rarely gets discussed. The shedding is often not purely hormonal. At the same time, the body may be also dealing with iron depletion, nutritional demands of breastfeeding, blood loss from delivery, sleep deprivation, and emotional stress. Multiple biological pressures converging together, not a single cause. This is a principle that appears throughout trichology. Hair loss is frequently a stack, not a single event, and understanding the full stack is the only way to address it properly. We covered polycystic ovary syndrome earlier, but it belongs in the life story too, because it often presents during reproductive years when women are least expecting a hormonal condition to be driving their hair changes. One of the most distressing symptoms for many women is hirsutism, excess terminal hair growth in areas where women typically have minimal hair. The chin, the upper lip, the jawline, the chest, the abdomen. What makes this particularly frustrating is that the same hormonal environment driving increased facial hair may simultaneously be contributing to scalp hair thinning. More facial hair, less scalp hair, different outcomes, same hormonal conversion. That juxtaposition, gaining hair where you don't want it while losing it where you do, is one of the most emotionally difficult aspects of this condition. It deserves to be named directly. Perimenopause is one of the most misunderstood stages in a woman's life, the years leading up to menopause. And this is where I see patients become most confused, because unlike menopause, which has a defined clinical marker, perimenopause is characterized by unpredictability. I have a story to tell you about a patient. She didn't come in because of hair loss. She came in because she felt different. Her skin felt different. Her sleep was different. Her mood was different. Her energy was different. Her hair was definitely different. What struck me about her wasn't the individual symptoms, it was how she described the experience overall. "I don't feel like myself anymore," she said. That phrase comes up more in perimenopause consultation than almost any other, because perimenopause isn't just a hormonal transition. For many women, it is an identity shift. And when the hair, skin, and scalp all change at the same time, it can amplify that feeling significantly. During perimenopause, estrogen and progesterone levels become less predictable. Fluctuations occur. The entire environment surrounding the follicle shifts. And because follicles are sensitive to hormonal signals, they notice every change. Then comes the menopause. And this is where the collagen cliff becomes most visible. Declining estrogen affects collagen production, skin hydration, skin thickness, elasticity, and sebum production. The changes in hair often arrive in the same window: reduced density, increased scalp visibility, finer texture, slower growth, reduced volume. An important distinction here is menopause doesn't automatically cause female pattern hair loss. What it can do is reveal existing follicular susceptibility that may have been quietly present for years. Women with greater genetic sensitivity, androgen signaling may notice more dramatic changes. Those without that susceptibility may notice relatively little. Hormones influence the environment, but they are not the entire story. Genetics, nutrition, inflammation, and overall health status all contribute to what happens inside that environment. Every patient asks me at some point, "What blood tests should I have?" And it is a reasonable question. Blood tests should always be requested and interpreted by an appropriate qualified healthcare professional based on your individual clinical picture. What I can tell you is what investigations tend to be relevant when we're trying to understand the bigger hormonal story. In a trichological context, clinicians often consider a full blood count to assess red blood cells and identify certain types of anemia. Ferritin, which reflects stored iron, is frequently examined, and many trichologists like to see levels comfortably above 70 micrograms per liter when investigating chronic shedding. Vitamin B12, which supports DNA synthesis and red blood cell formation, is another common consideration, as is vitamin D, which contributes to immune regulation and cellular signaling. Thyroid function tests are often included because thyroid hormones have a strong direct influence on hair follicles. That's a topic significant enough to fill its own video, which is exactly where we're going next. So the lesson across the entire video is about the question that most people ask, which is, what hormone causes hair loss? After the entire video, you can see why that question is too small. The better question is always, what is my hair responding to? Because the follicle is always responding to something, to hormones, to nutrition, to stress, to immunity, to metabolism, to aging, to genetics. Hair loss is rarely random. It is information. And once you understand how to read that information, the entire approach to investigation and treatment changes. Think back to the patient from earlier on in this video, the woman who was convinced her shampoo was causing her hair loss. She wasn't foolish. She wasn't lazy. She was doing exactly what most of us do, focusing on the only thing she could see. But her hair wasn't the beginning of the story. It was the final chapter of a biological conversation that had been happening for months, possibly years, before a signal hair appeared in her brush. Your hair isn't separate from your health. Your scalp isn't separate from your health. Your skin isn't separate from your health. They are biological messengers. And when something shifts internally, they often speak first. The question is whether we know how to listen. Now, if you've watched the entire video, I want to hear from you in the comments below. What was the first sign your body gave you? Was it shedding, thinning, acne, oily skin, facial hair, changes during pregnancy, changes during menopause? Because in the next video, we're going to go deeper on one of the most significant drivers of hair, scalp, and skin changes, thyroid disease. Because what most people think they know about thyroid and hair loss is only a small part of the story. See you there.